Good afternoon, everyone. Thank you for joining us once again for our weekly press conference on Delaware's response to the COVID-19 pandemic. We've reached, again, a new stage in our battle with COVID-19. It's a good place to be. I'm joined again, as usual, by Dr. Carol Rattay, who's the Director of the Division of Public Health. I can't say enough, Dr. Rattay, about you and your team and what they've been through this past year. Of course, A.J. Shaw is our Director of the Delaware Emergency Management Agency, really representing all the first responder community, the great partnership that we've had with FEMA, DEMA and FEMA together with the Dover Downs Speedway and the vaccination clinics that we've had there. Just a tremendous job on point. Working with Newcastle County and others to do testing, and we continue to test. I know you're going to have an update there, even with the reduction in the spread of COVID-19 across our state. The testing that we get gives us an idea where we stand, and we need to continue to do that, at least for the immediate future. We've reached a new stage, as I said, a week or so ago, 2 weeks ago, I guess, we received new advice from the Centers for Disease Control over mask wearing. Of course, we ended our mask mandate and adopted the guidance from the Centers for Disease Control, basically, which says that those that have been fully vaccinated don't need to wear masks, but those that are not fully vaccinated should wear masks in public settings. There are exceptions to that, of course. Wearing masks will be required in state buildings. You're required to wear masks in congregate settings, like prisons and skilled nursing homes, et cetera. Obvious places to protect the vulnerable and those that come in contact with others. We're moving into the summer season, the outdoor season, and you'll see similar to what we saw last late spring and early summer, a reduction in cases. Now, of course, we've significantly vaccinated more than 50% of Delawareans and continue to do that. That's really the challenge that we have ahead of us to get from where we are today, which will show the various numbers and that indicate the percentage of Delawareans who have been vaccinated, partially vaccinated with a dose of a 2-dose vaccine or the 1-dose Johnson & Johnson vaccine. Eligibility is opened up to the younger children and students, 12 and over, and we've got calculations of the vaccination rates for those. So let's take a look at the data. Just in terms of the spread, we've been looking at this information now for over a year, and you can see now we are meeting all of our goals. We're under 100 new positive cases on a 7-day moving average. That was the goal, to get under 100. This frankly puts us in line with where we were at the end of last summer, and we're headed down from here, hopefully. 3.1% positive tests that are taken. This is about as low as we've gotten. We have on a day-to-day basis testing percent positives that are below 3%. And I think we did maybe dip below 3% at one point last summer, but this is about as low as we've seen. And then 51 hospitalizations. We'll see in a minute the trajectory of the spread and the severity of COVID-19 by looking at those hospitalizations since the beginning, since we started keeping track of the data. But at 51, we're well below 100, which is where we want to be, and close to the low point, which was in the high 20s, I think, last year. Sadly, of course, over 1,660 Delawareans have passed away from COVID-19. Although we don't see many deaths on a day-to-day basis, I think only 3 deaths last week from COVID-19. Of course, every one of those a precious life and a family member, a friend of many. So let's look at the current hospitalizations. Again, this is a good measure of the spread of the virus in our community, and this, as measured by the severity of the disease requiring hospitalization. You can see the peak and the run-up in late April to early May of 2020, where we peaked at 337, April 27th, Delawareans being hospitalized. We gradually improved after that with the shutdowns and mask wearing and social distancing that occurred. Delawareans really pulled together. We did start to increase testing significantly through the summer, and you can see that the low number of hospitalizations hit a trough there at 29 on August the 16th in 2020. Then we had the post-Thanksgiving run-up, the December holidays in early January, to a peak on January 12th of 474 that were hospitalized, again, at a level that the hospitals could meet. So we didn't have the challenges of not enough critical care for those patients, but a very high level. And then the decline from early January as we started to vaccinate folks, and folks continued to follow social distancing and mask wearing till we hit a low point of hospitalizations on March 11th. And then another run up just recently until a peak of 180 on April the 21st, and then down the other side again. So a little bit of a roller coaster ride with a big climb there in December, January, as we started to vaccinate Delawareans. And so this really gives you a good picture of the spread of COVID-19 here in the state of Delaware, the peaks and valleys, the effects of the mitigation efforts that we took, mask wearing, social distancing, closing down businesses where people gather, and asking people and requiring people to stay separate. So we've been making real progress. On the next slide, looking at the vaccination rates, over 880,000 Delaware vaccines have been administered. And some of those vaccines, of course, are Pfizer and Moderna, which are 2-dose vaccination protocols. So we have 370,000 who are fully vaccinated with including the 1-dose Johnson & Johnson vaccine. So we're making real progress there. If you use CDC numbers, which include Delawareans who are vaccinated outside of our state, for those up 18 years of age and older, you can see 65% have received at least 1 dose. And so that could include 1 dose of Johnson & Johnson, and so they're fully vaccinated, or 1 dose of Moderna and Pfizer, and they need to complete that protocol by getting a 2nd dose. But having north of 80%, I think 70 to 80% the protection with that single dose. And then, of course, importantly, for those Delawareans 65 and older, we're just at 90% with at least 1 dose, and I know we're over 80% fully vaccinated. Really critically important, because those are Delawareans who are most at risk. If you look at vaccinations a different way by county and using 16 and over as the eligible population, you can see the difference of vaccination rates by county. Sussex County residents 16 and older leading the way at almost 63%. A little bit higher senior population down there, might explain some of that. Kent County lagging behind at 50%. Newcastle County just a little bit behind it at 59%. So we need to get those vaccination rates up across the board, challenge each of the counties to get up where Sussex County is. 70% is our goal for at least 1 dose of eligible adults in Delaware. So let's look at the vaccination administration rates. You can see first vaccinations started in December and ramped up pretty quickly into mid-January. You can see those 2 peaks in January and early February coincided with some of the big weekend clinics that we had at the motor vehicles. And then we continued as we got more supply. We had demand at this point in time that far exceeded our supply, and as our supply increased through the CDC, you can see the administration of the vaccine increased and peaked in early April, a time where we had the large weekend clinics at Dover Downs Speedway. And thanks once again to Dover Downs, to our partners at FEMA and DEMA for their efforts, to the paramedics from each of the counties who helped us with that. But since that peak in early April, the supply has increased, but our demand has slowed, as you can see the slope down. And so as we look to the goal of 70% of adult Delawareans vaccinated with at least 1 vaccine by July 4th, we're going to need to, we're doing that at a rate that would put us in line with that objective, but we need to flatten out that curve, provide some additional incentives for folks, take vaccinations, vaccine clinics to where people are, to educate those who are hesitant for one reason or another, and generally incentivize Delawareans, those who are not vaccinated, to get vaccinated. And so we've created a new program, Delaware Wins. We all win when somebody gets vaccinated. It's our vaccine incentive program. We have prizes in there as well for those that already have been vaccinated. The simple message here is that Delaware wins when everybody gets vaccinated, and we have some incentives as well as education that Dr. Rattay is going to talk about to make sure that you get vaccinated. So first, we want to partner with those businesses that really were hurt the most during this pandemic over the last year, businesses that were shuttered closed back last spring as we opened them up, as we got our control of the COVID, spread of COVID. But we're partnering with those critically affected businesses to provide prizes that they would make available to their customers. We're encouraging, obviously, customers to re-enter these hospitality businesses, gyms, salons, that type of thing. There's a place where folks can sign up if you're one of those businesses, and the state will support. Already small businesses are doing those incentives, both for their employees as well as for their customers. And this will be a partnership, I think, where everybody wins, and certainly Delaware wins when everybody gets vaccinated. Next up, our public health and DEMA vaccination clinics will offer incentives for people to come in and get vaccinated. $10 gift cards when you get vaccinated at DPH, Public Health, and our Delaware Emergency Management Agency clinics. We do have the curative partnership. They will be included in this. They're located both in Wilmington and in Georgetown, and now going out to various communities, taking vaccinations to the folks who need to get done. In addition, we will have lottery drawings for those ages 12 plus who get vaccinated from May the 25th to June the 29th. This is our really sprint to the end to get to where we want to be by the 4th of July. The President of the United States has put that goal out for us. And also Delawareans ages 12 to 17, some of whom have just recently been eligible. They will be eligible for these drawings as well. Automatically entered in to win $5,000 cash prizes and additional prizes. If you look at the next slide, you can see some of the prizes that we'll be raffling off. All of this will be run through the Delaware Lottery Office that knows how to do this and has the randomizer for which to do it. Full scholarship, drawing for a full scholarship to a public Delaware University. Annual Delaware State Parks passes, tickets to Firefly, and prize packages for Funland, the Wilmington Blue Rocks, and the Delmarva Shorebirds down there in Salisbury. And again, when people get vaccinated, Delaware wins, everybody wins, and everyone who has been vaccinated will be eligible for, vaccinated before June 30th, will be eligible for our big prizes, $302,000 cash prize, and 2 low-number Delaware license plates only in Delaware. Would one of the biggest raffle items be a low-digit Delaware license plate, and that's what we have here on tap for every Delawarean who's been vaccinated by June the 30th. So it's really exciting. We've got an objective out there that we want to reach. It is a bit of a stretch goal. It's a goal that's in line with what the President of the United States has set for us. We have our state lottery office ready and able to provide the confidentiality and the randomizer to offer these raffles and these drawings. And we look forward to encouraging more people to get the shot, protect yourselves, protect your families, protect the community. And when you do that, everyone wins and Delaware wins. Dr. Rattay.
Thank you so much, Governor. Clearly, this is the most fun and positive press briefing we've had the opportunity to do in the last year. Usually I begin with a slide on areas of concern, and for the first time since we established the current criteria this past fall, we have no areas of concern, no zip codes in Delaware that meet the criteria for having a case rate higher than 250 cases per 100K people, or no zip codes with higher than a 15% positivity rate, or with 5 or more cases. And so that's really exciting for us. Also, along the lines of good news, as the governor said, I mean, our case rates, our positivity rates have decreased in all 3 counties. Kent County saw a significant decrease in cases, 48%. Hospitalization rates have decreased 17%. Now, we still see the highest case rates among our 18 to 49-year-olds, which also are it's the group that is least likely to be vaccinated among our eligible population. So again, we are very encouraged by the news and continue our efforts to promote vaccination among Delawareans. This slide on variants, as we have been presenting every week for well over a month, we're looking very closely at a sample of positive cases in our state. Now we're testing about 10% of the specimen in our state. And of those specimens that are tested, about 49% are coming up positive for one of the variants of concern. And that's actually been decreasing. A few weeks back, it was 66%. Last week, it was 57%. So about half of the specimen we're seeing now are these variants of concern or interest. Of note, one of the specimen that was tested last week was the variant from India that we've all been keeping a close eye on. And the individual who did test positive for India does not have any history of travel. So that tells us that we are experiencing some community spread of this variant. What it means, it's too soon to say. CDC is looking very closely at this variant. It does appear to be more contagious even than the UK variant, but we still need to learn more about the implications of the India variants. So I want to talk a little bit about the science behind how do we increase our vaccination rates. And there's really kind of 3 key levers that we have been working on to increase vaccine confidence and uptake in our state. One is around education and tackling misinformation. It's really important that people have correct information, especially around how effective the vaccines are and what side effects have been found. And the great news is these vaccines are extremely effective. The latest data, especially looking at the Pfizer and Moderna that have been the most studied at this point, real world studies are again confirming a good 94% effectiveness or higher, and extremely effective in decreasing hospitalizations and deaths. And again, the side effects for these vaccines are just very, very limited, so very well tolerated. But there are a lot of myths out there on the internet. And so it is important that we continue to get the facts to people about these vaccines. We have launched several campaigns. One focuses on the safety of the vaccines by prominent Delaware health providers. Another focuses on the moments that Delawareans have missed out on over the last year, but can safely participate in once vaccinated. So we're going to continue to get information out there as best as possible, so our public is well informed about the vaccines and really to counter some of the myths and misinformation out there. Facilitating the vaccines or really increasing access to vaccines by reducing logistical barriers is also a very important strategy for getting people vaccinated. This includes offering free transportation, which AJ is going to talk more about, offering walk-in hours instead of requiring appointments, setting pop-up vaccination sites where people are, like festivals. All of these things matter. Our pharmacies throughout our state now have vaccine readily available. Many are doing the walk-up sites. We have an increasing number of vaccine providers. So many physicians, healthcare practices have been signing up even over the last few weeks to provide vaccines. So more and more healthcare providers are counseling patients and providing vaccines to their patients. And then as we've talked about the last few press briefings, we have a number of DPH sites, 9 DPH sites throughout the state that are all walk-up. They provide Pfizer, and soon all of them will also be providing the Johnson & Johnson vaccine. So, lots of access available. If people are interested in having vaccine events, please email us at vaccineevents@delaware.gov. We want to be where people are to make it easy for people. But please help us get the word out there that the vaccines are easy to find, and people can go to our website, just Google Delaware, get my vaccine, and you can find all the locations, or many of the locations where the vaccine is available, and the details about those vaccines. Finally, I want to talk about incentives, because we know that incentives do drive uptake. They drive positive health behaviors around vaccines. They can drive uptake among those who are less motivated to get the vaccine. It works. Incentives work. Other states have seen incentives work. So, for example, Ohio and Maine have both recently been sharing the experiences that they've seen in their states by offering incentives statewide, but also with the groups that we really want to make sure that we reach: our younger population, our younger adults, as well as in the rural areas of the state. So from a public health perspective, we are super excited about the DE-WINS incentive program. So on the next slide, let's focus a little bit on today's exciting announcements. DPH and DEMA, as the governor said, are partnering to get gift cards available at vaccine sites. We've purchased 6,500 $10 Visa, Grottos, and Wawa gift cards, which will be given to any person vaccinated starting today at DPH clinics and at the curative sites, as well as some of the DPH and curative sites throughout the community. And we hope to expand these locations where gift cards can be offered from any of our vaccine providers. But to get this started right now, you can get these gift cards at our DPH and our curative sites. In addition to the gift cards, we are really excited about the opportunities for the DE-WINS raffle. This raffle is available to all vaccinated Delawareans aged 12 to 17, but only to Delawareans who are 18 and older who are vaccinated on or after May 25th, except for the big prizes. This is because, so this younger group, the 12 to 17 group, or adolescents, have largely only been eligible for the vaccine for a short amount of time, and they can only get the Pfizer vaccine. So as the governor showed you, there will be a specific prizes for this age group. The great thing is that the only thing you have to do to be entered is to get vaccinated. There's no entry forms that are needed. It doesn't matter where you are vaccinated to be entered for the raffles. DPH will use the data from our Delvac system to provide to the DE lottery with anonymized numbers, and the lottery will randomize the numbers and pull out a winner. And the winners will be contacted by phone after being pulled on Mondays and Fridays. Also, again, just to reiterate that we protect individuals' rights to be anonymous, but we're also happy to help share the excitement that you've won a prize if you wish. So with that, happy to hand it back to the governor.
Yeah, so the first time in a long time that we don't have any areas of concern because of increased spread of COVID-19. Really good news, lots of information about the incentive programs to try to reach our goal with folks getting vaccinated, particularly leaning into the younger students, young adults and students who have recently been eligible. We also know that our vaccination rate among the young adult crowd is considerably less than 50%. So a lot of the efforts will be in partnership with establishments that young adults like to frequent and our partners there. So really looking forward to working on that and providing information for people to make informed decisions about getting vaccines, getting vaccinated if they have hesitancy based on myths that we know are out there. AJ is still testing strongly and winding down a little bit, but we still got a lot of work to do. Thanks again to your team, our partners with Newcastle County who've stopped doing the testing. They've got other things they've got to attend to, but we appreciate their partnership over the last year.
No, absolutely, sir. And good afternoon. And we'll start with the testing recap from last week. So we did see another, pretty big decrease in testing numbers between the week of the 15th and the 8th, dropped about 3,000 tests over the week. At the same time, we're still going to be above that 80,000 number. A lot more people now vaccinated than there were, just 4 months ago and even a year ago when there's nobody vaccinated. So definitely expect this number to potentially continue to decline as we enter the summer months. We know our institutes of higher learning had mandatory testing. That is day end for the summer. Those numbers will be going away. We have individuals or students that were testing for sports or extracurricular activities. That will probably be, decreasing some. But at the end of the day, we still have options available. And, we want everybody to go to de.gov/get tested. We want to make sure they know that we have ample opportunities out there. We still have Walgreens sites open. We have some of the state public health clinics open. We have curative travelers that are making the rounds around the state. So there are absolutely options for people to get tested, as well as the at-home option as well, where we could ship it right to your house and you drop it back in the overnight box and get your results in about 24 hours. As we talk about testing, we have to ask people to remain, disciplined and vigilant, really, where if they're showing signs to, stay at home. I think just because people think they are, in a safer environment now, that maybe, they could push the limits a little bit. But remember that if you're not feeling well, get tested, talk to your medical provider and figure out when you should return to work or school. Next thing we'll talk about is really the vaccination effort. So as we get ready for this incentive that was the governor announced today, partners around the state, the pharmacies, our hospital systems, our partners like Curative, the community health centers and clinics that have walk-in hours and the standalone sites. All that information can be found at de.gov/getmyvaccine. It gives you a lot of options, finding something that's in your backyard. And then Dr. Tate talked about the logistics of getting there. So we have some exciting news from our federal partners with the rideshare apps, Lyft and Uber. I think we have, I'll first back up and say, kudos really to Dr. Ortay's team and Lisa Henry and the community health team, because they have been matchmaking individuals to make sure they got rides to and from their first and second dose appointments now for months. But we have some support and other option right now from our federal partners. So both these rideshare companies have announced free rides for vaccines. If you have their apps downloaded on your smartphone, you'll launch to them. They both have a Get My Vaccine type, button to push that starts the process, and you could get the credits to get free credits to go get your vaccine and make that appointment. So just one more thing that shows the power of the private-public partnership when we're dealt with a pandemic or any type of emergency like this. So that's all I got today, sir. I'll turn it back over to you.
Thank you very much, AJ. Again, thank you for your team, all the first responders, everybody who's been pulling together to get us where we are today. More than half of Delawareans vaccinated, more than 60% with at least one dose. Closing in our goal, we still have a lot of difficult work to do here to get where we need to be by July 4th. Uber and Lyft stepping forward to take away the excuse that you can't get a ride to get your vaccine. We're taking the vaccine closer to folks in any case, teaming up, as you said, with Lisa Henry and her team, getting directly in communities. We will have our public health and DEMA clinics, which will make available the prizes. The raffles will be done in a randomized way by the Delaware Lottery Office. We appreciate all those partnerships. So just before we end up and take questions from the media, remember COVID-19 vaccine, sign up today, de.gov/getmyvaccine, or you can call the number 833-643-1715. We still have a lot of work to do. We're in a good place. We're under 100 new cases per day, closing in on 3% positive, only 51 hospitalizations, and getting healthier every day. So thank you for joining us. I look forward to the questions from the media.
Right, first we'll go to Nick Cialino with Delaware Public Media.
Good afternoon, everyone. Curious, how much does the incentive program cost and how is it funded? Is it through the state general fund?
Yeah, I don't have the total number, and there's the possibility of adding to it. My understanding is the federal money is that these incentives qualify under that. We had a conversation with the White House Task Force just today, and we heard from the governor of Ohio and the governor of Maine, as Dr. Rattay said, to talk about what they're doing. And we're pleased to have the opportunity to provide the incentives and the education the Department of Public Health will provide to get more folks to get that life-saving vaccine.
And then Dr. Rattay, you were speaking earlier to the safety of the vaccine. Do we have a sense at this time how common serious side effects are just in the state of Delaware from getting the vaccine, and breakthrough cases as well? Do we know how many of those there are at this time?
Yeah, so overall, serious side effects have just been very, very minimal. For the most part, we see some arm soreness, your typical, you might get low-grade fever, headache is not uncommon the day after. Many people are fatigued. So it really isn't uncommon to feel under the weather within 24 hours after. But as far as serious side effects have been extremely limited overall. We've had a total of 302 breakthrough cases in the state that we are aware of. So those are individuals, they may have symptoms, they may not have symptoms, but they've been fully vaccinated and then have become positive, which again, really considering the fact we've been vaccinating since December, and we've had some pretty high levels of virus in our community up until now, where of course we're doing much better. We see that as a pretty low number of breakthrough cases, meaning these vaccines really have been very effective in preventing viral spread, but also certainly hospitalizations and death.
All right, next we'll go to Tim Mastro with Delaware State News.
Hey everyone, good afternoon. Just wondering on the incentive program, when you first started vaccinations, was it always the plan to kind of eventually start offering incentives, or is this just seeing how well it works in other states and thinking it can work pretty well here in Delaware?
Yeah, no, I think it was something that came to us as we moved along. Initially, as I said a while ago, we had tremendous demand and not enough supply. And for the longest time, as you looked at the trajectory of the administration of the vaccine, each of those clinics was oversubscribed. It was difficult to get an appointment. We had, within the first couple of days of the signups from the 65 and older population, over 100,000 people signed up. which was an indication, and we didn't have anywhere near the number of vaccines to accommodate that. And so though, as we move through January, February, March, the supply increased, and so did our vaccination rates, as you could see from the graph. And as I'm talking, if somebody could put that graph back up, you can see it. And so then all of a sudden, it happened pretty quickly, you know, and it was the same. You can see that peak. So right around Easter time, as I recall, early April, we peaked out. We were having the weekend events at Dover Down Speedway where we were doing, you know, 9, 10 to 15,000 a weekend. And then it started to, you know, we had troubles providing enough appointments for everybody. Then we had trouble getting people to take some of the appointments. And so you can see the decline after that. So as we evaluated this, and this was happening in states across the country, as you accommodated those who were motivated to get vaccinated, then you have some that were hesitant, a little bit hesitant, some that are more hesitant, some that, you know, aren't going to be vaccinated, don't want to be vaccinated at all. We're trying to get to each of those populations and try to get them over the line. And the incentive package that we've come up with today, we read and heard about what was happening in other states, and we thought we would include that as an additional incentive to meet our goal of 70% by July the 4th, which the president set out there for us a couple months ago.
All right, and then I just want to ask a little bit more for specifics on the situation in long-term care facilities now with the new guidance. Assuming most residents are fully vaccinated now, just how does the new guidance with mask wearing, social distancing affect those residents, and what maybe can they do now that they couldn't have done over the last year when they've been in isolation or following all the restrictions in place?
Dr. Rattay, you want to take that one?
Yeah, Tim, I will share what I know. And I will tell you that, you know, a lot of the decisions around long-term care are decided by our Division of Healthcare Quality, along with CMS, the federal CMS agency. And so there have been some evolving guidance in long-term care. The great news is that uptake among residents has been very high. So uptake of the vaccine among residents has been approximately 80%, which is good. And in fact, it is likely even higher now than we had that statistic. As far as staff, the uptake is not as high as residents. Earlier figures were suggesting that was around 50%. And so a lot of the guidance now, as it pertains to residents in long-term care facilities, allows those residents who are vaccinated to congregate near one another. So have, you know, dining experiences again, like they have in the past, visitors, and masks are not required usually when you have vaccinated persons involved in activities. And so, you know, I think this has not just been a great step forward as it relates to infections and deaths in long-term care, which are rarely seen now, but also just for the standard of living for individuals who reside in these facilities. They're now able to socialize again with one another and have freer and you know, hug their family, freer visitation and hug their family members when they come to see them.
So just to the other part of your question, Tim, the original budget for the incentives was $5 million. Just to give you some context, we've spent over $200 million for replenishing the unemployment insurance fund, over $125 million to support daycare facilities, and a similar amount, I believe, to support our hospitality and smaller businesses. And so just to give you some, you know, order of magnitude.
right, next we'll go to Amy Cherry with WDEL.
Hi, everyone. Thanks for taking our questions. I'm wondering if you're at all worried that prizes and other incentives to get the vaccine devalue it, and that if in the future we're ever in a circumstance like this again, you would see more holdouts.
You know, we're just pretty focused on getting people to get vaccinated in the short term, obviously to meet our goal and so that we can bring businesses back online and reduce some of the real challenges that people are encountering, with particular focus on getting our students back in school. The costs of not doing this, doing everything we can to get people vaccinating are enormous. And we can add it all up, what has come before. We can talk about the health and other issues that have occurred in addition to COVID-19. And so doing everything we can to get people vaccinated, we think is incredibly important.
And second question, the COVID-19 vaccine is supposed to be free. How many instances of people getting billed have you received or are you aware of, and what are you doing in those circumstances?
Yeah, I don't know the answer to that question. I don't know whether Dr. Rattay does or not, but we can certainly, I have not heard of many. We have certainly made it clear that they are free. There are some occurrences where a copay has been, the people get a copay, but there's also an insurance that goes to the provider of that vaccine. But I don't know off the top of my head. We could try to get you a number there, and it strikes me to be a hard number to estimate.
Yeah, I have not been made aware of anyone who has been asked to pay out of pocket for vaccine in the state of Delaware. It is, however, appropriate for people with insurance to have their insurance company be billed for the administration costs.
All right, next we'll go to Brandon Holbeck with the News Journal.
Good afternoon. I'm curious who or how you thought of the idea to give away the low-digit license plates, and how low are we talking with those low-digit license plates?
Yeah, it's been a team effort. You know, I don't remember whose idea it was exactly. I'll give it to Dr. Rattay and AJ. They came up with it. Dr. Rattay doesn't want to respond. No, you know, we know how Delaware. We wanted to make this fun. We wanted to make it very Delaware. $302,000 grand prize for everyone who's been vaccinated. Delaware wins. We win 302. And of course, everybody knows how much people really enjoy the low digit numbers. My understanding is that the numbers are 3-digit numbers.
Great. And my second question is on the topic of testing. Is there an kind of idea of how long you think the current testing setup will last, or what types of testing facilities will remain sort of longer term as numbers, hopefully continue to be at this low level or perhaps even lower?
Yeah, we scratch our head about that quite a bit because obviously as we get healthier, the cases drop, people aren't symptomatic, they get vaccinated. The numbers are just going to, of positive cases are just going to go down as they have. So, but you want to have some kind of indicator out there of whether there is any spread. Dr. Rattay, any thoughts on that one?
Yeah, well, it's a great question. I mean, it's as the number of cases go down, it's not surprising that we see less testing because there's less people who are exposed, less people who are having symptoms. As we shift our thinking to COVID-19 being more just a regular virus that's out there in the community, which we hope that we can get to the point where it is considered a regular virus. It's going to be important that people can get testing, and anywhere they go, including it is expected that more people will do home testing options. in the not too distant future as well. So testing will continue to be important, but it will continue to evolve like everything in this pandemic has.
All right, next we'll move to the pre-submitted questions. The first question is from Melissa Steele at Cape Gazette. She asked if UD is considered a public university, or more generally, what schools qualify under the scholarship in the incentive program?
Yeah, so the three schools that qualify are University of Delaware, Delaware State University, and Del Tech.
All right, next question is from Cody Decker at WRDE. He asked, today being the anniversary of George Floyd's death, what are your thoughts on the police reform bills that were introduced in the Senate today?
Yeah, so, you know, the incidents like the George Floyd in Minneapolis are sad, and they bring to mind the history of race in our country. It's been a challenging year with COVID-19. It's been a challenging year with the issues brought to the fore from these terrible events. We have leaned into it here in Delaware to do what we can to improve the relationship between communities of color and law enforcement, and we continue to try to do things to improve that relationship. I understand there's been a task force established. I issued Executive Order 41 to ban chokeholds among executive branch law enforcement agencies, to increase de-escalation training, to advance transparency of use of force rules across our state. We've supported body cameras. I understand that legislation is moving through the General Assembly there. We've made funds available there. I know the city of Wilmington has passed citizens review. I think that's something that we should do more statewide. So there's a lot of things that have been done, a lot of progress that has been made. There's work continues that we need to continue to get done, which includes looking through the Law Enforcement Officers' Bill of Rights. Obviously, the devil is in the details there with respect to qualified immunity that most state employees, all state employees enjoy at some level. I understand that there's legislation have been introduced. I've not been able to read each of the bills, but they address some of these more important issues, and I'm sure there's going to be debate. We look forward to having a discussion about it that frankly brings us together, that seeks to heal the wounds between communities of color and law enforcement. We know how important law enforcement is to the safety of every community, and we know that every citizen in our state deserves to be treated equally by law enforcement. And we've seen too many incidents where people have been killed or injured in those encounters.
All right, the next question, this is the last question for today. It's from Jared Leedy at WRDE. Governor, what is your message to Delawareans as we get closer to summer with the loosened restrictions?
Get vaccinated. You know, the most important folks can do now is to get vaccinated. If you haven't, if you have, encourage your relatives, your family members, get your younger children vaccinated. In particular, make sure most people 65 and older are vaccinated, as you can see by our numbers, 90% with at least one dose, more than 80% fully vaccinated. Our young adults need to get vaccinated as well. And if you do, Delaware wins, we all win. The incentives, now we have incentives, so it's another reason to go in and get that life-saving vaccine. It will help all of us. It will help our economy. The cost of this pandemic on our lives, on our family members, on those we've lost, 1,660 Delawareans, it's just tragic. The financial cost to businesses, to individuals, to governments has been like nothing I've ever seen. And we know now that there's a cure, if you're not a cure, but there's a way that we can effectively stop it, and that's by everybody getting vaccinated. So that would be my message: get vaccinated, and we'll get life back to normal here in our state. We'll still have the challenges that we just talked about, but I'm just confident as governor, seeing the way I've seen Delawareans step forward to work together, to be selfless, to think of others before themselves, makes me very optimistic about the future. So thank you to the media for joining us. Thank you again to Dr. Rattay and AJ Shaw, and thank you to Pam, who's our sign language expert for the deaf and hard of hearing and joins us every week. Thank you very much. We'll see you next time.